all of that stuff. So I'm critter-rittering it again.
It works, guys. I use it.
Oh, yes, yes. See, another ringing endorsement.
We're gonna call you guys. You guys are gonna get the Wilderness Explorer patch from Up.
Well, I just see a picture on here of a woodchuck consuming some dianthus, which makes me very unhappy because I have dianthus and I love them. So I hope that little critter wasn't munching on my dianthus down the road here.
Oh, wow.
I mean, you could just buy a pellet gun and shoot them.
My husband has a paintball gun that shoots those tiny little paintball BBs,
Yeah.
and he's
We are
always
live on
threatening-
YouTube.
Thanks, Rocky. We'll be live on YouTube in about a minute.
Thank you, Rocky. Don't want the
Welcome, public, to our woodchuck
ASPCA
discussion.
Hmm.
We are live on UGTV.
All right, let's get the show on the road. Before I call the meeting to order, I want to announce that due to COVID-19, we have individuals attending remotely. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure you announce yourself by name and title every time you speak, so the public that is participating knows who is speaking. This is critical given the number of remote participants and is current guidance from the Kansas Attorney General. Call the meeting to order. Clerk, please announce the meeting and call the roll.
A special session is being held on Thursday, August 13th, 2020 at 5:00 p.m. for an update regarding the COVID-19 and a new medical order regarding your youth sports. Roll call. Burrows,
Here.
Townsend,
Here.
McKiernan,
Here.
Ramirez,
Here.
Johnson,
Here.
Kane,
Here.
Markley,
Here.
Walters,
Here.
Philbrook,
Here.
Bynum,
Here.
Alvey.
Here. All right, so tonight we have an update regarding COVID-19 and a new medical order regarding youth sports. And I'll turn it over to Mr. Bach to introduce staff.
Thank you, Mayor. With the events of this week, a lot of communication that was going on between our medical staff and the health department, with the superintendents of the schools and other agencies in the community, and are proceeding to move forward to issue the order today regarding sports. We felt that it was important to call a special session to give an update on where we are with COVID-19 today in the community, and then to talk through and give the commissioners an opportunity to ask questions about the new sports order. So with that, I'm going to turn this over to our Director of the Health Department, Julianne Van Loon, and let her go through the COVID update with her staff. Julianne?
Thank you. Good evening, Mr. Mayor, Commissioners. Thank you for having the Health Department back this evening. As Doug mentioned, we'll give kind of a brief update on the data like we do every time, and then we will focus in this evening on the orders related to school. So I have with me Dr. Erin Greiner, our Deputy Health Officer, and Dr. Erin Corvo, excuse me, and Dr. Alan Greiner. So we will start with the data. As we've seen in past months, our rate per 100,000 in Wyandotte County remains at least 3 times as high as our surrounding jurisdictions, unfortunately. Our rolling averages of new cases, however, is steadily coming down. So you can see here on the right that our rolling average is now about 44 or 45 new cases a day. This is obviously much more manageable for our contact tracers than the 94 new cases a day we were getting just about a month ago. We are trying to watch this trend really carefully. It's certainly a very positive trend. We do not know to what extent some of this reduction in positive cases is due to a reduction in testing. So we are seeing decreased numbers of individuals coming to the health department for testing. We're now averaging 100 to 125 folks a day tested at the health department compared to about 350 4 weeks ago when you see kind of that spike there. So We are a little bit behind on contact tracing, meaning that fewer contacts of positive cases are being notified and coming to the health department for testing, which then obviously plays out in reduced cases. So we think this number is very positive, but we're also remaining cautious as we watch this trend. Our 7-day moving averages of deaths remain quite low. We did unfortunately go past the 100 death threshold just recently this week. So we now have 102 deaths in Wyandotte County. Of the last 5 or so deaths that we've had, unfortunately, those have all been among 50-year-olds. So a little bit younger than what we were seeing in our previous death spikes in Wyandotte County, which is obviously concerning. A number of those individuals did have comorbidities. But again, we're keeping our eye on that trend, especially as we're seeing the deaths among the younger population. Our percent positivity, so again, the number of tests that come back positive out of the entire number of tests conducted is our percent positivity, and that 7-day rolling average is staying, it's really just hovered right around 20% for the last month or 5 or 6 weeks actually. It's one of the areas we're struggling with. Our numbers of cases are coming down, but our percent positivity is not. So we know the disease is still pretty prevalent in our community. And it really, again, brings into light the question about, are we seeing reduced numbers because people aren't coming or because there's actually reduced transmission in our community? And that's a difficult one to understand. But our percent positivity remains significantly higher than surrounding jurisdictions where they're seeing 10%, and in other areas even lower than that, down in 3 to 5%. So our percent positivity remains a concern. I'm going to swing this to Dr. Alan Greiner to talk about race and ethnicity variation we're seeing in our case and testing rates. Dr. Greiner?
Thank you, Julianne. We're really not seeing a lot of change in our race-specific case rates or really our race-specific testing rates. We continue to see large numbers of cases in Asians. If anything, I think we've seen a reduction in the cases per 100,000 among African Americans, although we're not sure how that relates to uptake of testing versus other issues. As far as the overall, that's fine, Julian, you can go into that one. As far as the ethnicity specific case rates, again, it's very similar to the last time we presented that the case rates are much higher in Hispanic groups, and the testing rates are pretty equal, maybe a little bit higher among Hispanics, which is a good thing, but may mean we need to target other groups going forward. Next slide. Continuing with the same issues around schools, and have been working this last week and this week to review individual plans from school districts and individual schools. Schools will be opening under those plans September 8th. Mask use will be part of that. We'll be having cohorts of students as staff as much as possible. The 50% density idea is in those plans. Next slide. And then I think we're going to Dr. Corbo.
Good evening, everyone. I just wanted to cover a little bit about this new order, which is actually came out today and will be enacted first thing Friday, I guess this evening. This is our order for sports participation in Wyandotte County. This order is going to apply to both public and private schools, and also higher education and non-professional sports organizations such as club teams and the like. We had a lot of discussions within our health department, our epidemiology team, and also we have a really great working relationship with our superintendents in the county. There was a lot of concern, of course, about coming back to school, but also about the issue of sports play this coming year. In the end, we decided to exclude sports that we felt were contact sports this year, and that includes, or for this fall, that includes football, soccer, volleyball, and band. And there's been a lot of issues with this band, saying, is band a contact sport? And no, of course not. But there is a high risk for aerosolized particles and aerosolized virus that we thought was just a far greater risk than we would want our students to be exposed to. We are, however, interested in seeing that our kids remain active. Of course, we're going to certainly encourage conditioning and exercising in a non-contact way to continue. And we even feel like within the teams, you know, if they can do conditioning and activities like drills and such that would keep their skills up, but could be done in a socially distanced way and in a non-contact way, that would be just fine. Those sports that we've named as able to go forward in this order in the fall would include debate team, cross country, golf, tennis, and spirit team. We've reviewed in detail the Acacia rules, and they have some great mitigation strategies there that we thought were really excellent. And so we would love our students and club teams to adhere to those rules. Of course, we want to stay consistent with the other orders that we have put in place in Wyandotte County. And so we're going to continue to ask that people playing sports will adhere to mask wearing rules when inside, and then when outdoors, if they can't socially distance, then they must be masked as well. We're also stating, again, as in phase 3 order, which we're still in, that we will only be allowing gatherings of 45 people or less. And I think that's where we're going to end, and we can take questions there. Julianne, I'll send it back to you.
Oh, you're correct. That's the end for us. So questions?
Mr. Ramirez? Commissioner Ramirez?
Thank you. Yes. Thank you, Mr. Mayor. And thank you, Julianne, Dr. Corvo, Dr. Greiner, for everything you do and continue to do in the health department. This is in my opinion, I think Wyandotte County has responded to this virus and crisis the best that it can, and the best in the state, just because with your leadership, you don't base it on politics. It's based on data and compassion for our county. So thank you very much for all that you and your department does. My question, because the school district also voted to suspend all fall sports, which of the orders takes precedent? Ours or the school district's vote on suspending? Because in theirs, they say cross country is suspended, but then in our order, it allows cross country. And so I want to make sure that people understand which order takes precedent.
Yep, thank you for that question, Commissioner. It's our understanding that USD 500 can issue more stringent rules. And so I believe, and we have asked for legal guidance on this, but I believe that the school district will take precedent.
Okay. That's what I kind of figured, since they're the ultimate governing body for the school system. And so I just wanted to have that clarification. So thank you very much.
Okay. And may I just clarify a little bit more there, Mayor? So Dr. Corvo, you said theirs takes precedent to be more stringent, but it does not take precedent if they were less stringent. Ours, it's the more stringent policy is what takes over in this case. So if a school district were to take it and not follow this and said, well, we're going to allow soccer and volleyball, that wouldn't, our policy would be the one that would be override theirs at that point.
I believe that's true. Doug, that's a great question. We have our legal team reviewing the communication out of the Attorney General's office. And so I believe we'll hear more on that, but that is our understanding at this time.
Mr. Bach, is Ken Moore. We've looked over the statutes governing that gives power to school boards, and also the statute that gives power to the local health officer. You know, the statute that gives power to school boards makes them subject to all other laws, and also limits the operation of schools, whereas the health officers, local health officers' powers come from the statute are more broadly based. So our opinion is that that would control, but the school boards can enact more stringent measures should they so desire.
So sorry to jump in. So our order is like the baseline.
Correct.
And the school district can just get more stringent if they so chose.
Correct.
Okay. Thank you very much.
Commissioner Bynum?
Thank you. I would like to ask several questions. I would like to understand clearly the level of communication that we have had with the Wyandotte County superintendents and all of the education leaders, Casey, KCC, Donnelly, whoever is putting teams on the field this fall. And at what point did those education leaders understand that this order was going to be put in place? I'm getting communication from other districts, not KCC, or excuse me, not KCK, obviously, since they announced their decision several days ago, but within other districts, it strikes me that the communication is that they found out today. And I want to clearly understand what communication we've had. I was under the impression that all the way through this entire COVID time, we've been in constant and regular communication with all of our education professionals in Wyandotte County. That's the question that I have. The only comment I want to make is I'd like to understand better why the decision was made based on the data that's been presented to us tonight, which appears to show improvement, because it makes me so incredibly sad for all of these, particularly senior athletes, and sad in general for all of our students, because, you know, they're already forced into online school and have had so many activities and opportunities taken away from them. And now to take away these sports, it's just so much to ask of these students and their families. So if I could just have more information on all of that, please.
Yes, thank you, Commissioner Bynum, and others from the health department. Please jump in if I leave things out. I think many of you are aware that Dr. Corvo assembled an education task force 2 or 3 months ago that involved all levels of educational institutions in our county. That split out into several working groups that then put together detailed plans for our educational programs and all the institutions in the county. There was regular meetings, lots of back and forth work on those plans. I think everybody felt like there was strong consensus out of that activity. During that work, we didn't get into the specifics of addressing sports. Although I personally feel like there was a lot of understanding of our concerns related to all sorts of student interaction, and that everybody knew we would be coming forward with an opinion at some point on the issue of sports. Those were task force specific meetings. We went into, in the last few weeks, we've had several meetings and a lot of online conversation with the school district superintendents in the district and the archdiocese representative for the Catholic school systems. And we had a meeting last Wednesday or Thursday, I can't remember what day it was, with that group, and basically outlined exactly.
I'm looking at our health order now. Did you guys vote on that? We're doing a Zoom meeting now.
Somebody's not on mute. We actually announced to them at that meeting that we would, was it last week or was it the week before? I can't remember when it was, but long before this, we finished the order today. those superintendents were on a call with us. Actually, the one group that Dr. Faust wasn't there. The next day he announced he
just said it.
was moving to North Carolina. But we did, in that meeting, they did not, nobody specifically stated opposition to these ideas. And I think they felt they had an unclear understanding of where we were coming from and why we were moving in this direction. The community college was not on that call. But again, I think that they knew our concerns about this because of all the other meetings we had and the work we had done collaboratively together in the prior days. In addition, you know, this order, we've been kicking this around for almost 10 days. And so the superintendents knew because we announced it in a call with them. I think we're surprised that it wasn't out there more widely known before now. But obviously it wasn't. And I think we all agree with you that this is very sad. This is a horrible thing to have to do in regards to our educational programs, the way schools work, the way social interaction is a huge part of learning and growing. But we, even with the improvement in the cases we are seeing, we are extremely concerned that students will pass the virus back and forth if they are in close proximity and doing things such as yelling or even communicating the way they have to do in some of these sports. Having direct physical contact, of course, we think puts people at risk, even if they're masked and wearing face shields and all that sort of stuff. We feel like there's more and more evidence that this virus gets in the air when people yell. And that others inhale it, and that's sometimes impossible to stop from happening. And as Julianne mentioned earlier, we are seeing relatively young people die from this virus. You know, our last 4 or 5 deaths have been 50-year-olds, and I think we feel like we can save lives with this, and that this saying, well, we can't stop everyone from dying. We just don't think that's a way to approach it. And it's not something we would do with other infectious diseases either, whether it was tuberculosis or hepatitis or HIV. I think we would try to find a way to stop spread. So it's a horrible thing to do. It's really, really tough. But it's like many of the other decisions we've made previously, you know, in terms of shutting businesses down and requiring people to change the way they live life. So it's tough.
I would also make a note, going back to the evidence, that currently in Kansas, there are 9 outbreaks related specifically to youth sports in our state. And that has spread among those to almost 100 people now. So this is a very real concern. And again, to echo Dr. Greiner, we do not take this lightly. All 3 of us participated in high school athletes. We don't want to make this decision. We feel that we have to make this decision because it follows the data and the evidence that we have in front of us.
Commissioner Kane?
Sorry about that. I was talking on the phone to one of the school board members. What is the Johnson County area doing?
Commissioner, our understanding, we've spoken with Sammy Ariola, the director of their health department. I do not believe that they will be issuing an order related to this. They haven't been issuing orders and rather recommendations. I do not know, and I don't think that they are sure at this time if they'll be making a recommendation regarding school sports.
Do we know what Lansing or Leavenworth's doing?
I do not. We have spoken with Kansas City, Missouri, and also with Jackson County in thinking about this. I think they're a bit further out from issuing orders themselves. I do know that the Mid-America Regional Council was very interested in our thinking and leadership on this, but I don't think that they are at the point of issuing an order quite yet.
Okay, if we go on 3-4 weeks, a month, Or are we going to take another look at it and reconsider it? I mean, if the numbers go down, things start looking better, is there a possibility that we can restart sports?
I think there's always that possibility with any of our orders. I think what we're seeing though in the United States versus what we're seeing in other countries is that the level of transmission can be driven down to an incredibly low level. So other countries in the world that have had, you know, thousands of cases have gotten it down to where they're getting trickles, you know, less than 50 new cases in the entire country. And if we get to something like that, I think we can change a lot of things. But I think what we worry about is that with the lack of a unified sort of approach to this virus and the competing opinions about what makes the most sense, it'll be hard for us, even though, as I think Commissioner Ramirez pointed out correctly, we have in some ways led the Metro with a lot of our efforts. And I think it's showing in this data Julianne showed. We're going to have trouble because of what the other counties do and what other states do. But we're going to absolutely keep looking at things, and we'd be happy to meet with this group and specifically talk about this again in a few weeks. That's absolutely a worthwhile thing to do.
Well, and because here's what's going to happen. There's a Piper soccer club team, a couple hundred kids, and they play mostly in Johnson County anyway. So I just want us to remember that. And then I want us to maybe every 2 weeks take an evaluation to see, okay, are we getting there? Can we start letting the kids play sports? And I know being able to practice is fine, but the game day is always the game day. And I absolutely feel extremely bad for the seniors and the opportunity that they could or could not have. But at the same time, I also want all of Wyandotte County to be as safe as possible. So I don't envy your job at all. I am currently getting a lot of pressure, and some people absolutely don't like it. And that's why I say I think we need to take a couple of stabs at the apple before we shut everything down.
I think if I could, one of the things we have to, in terms of keeping this in perspective, when you look at how professional sports are able to move forward on this, whether it's sporting or the Kansas City Chiefs or the Royals, the amount of money and resources that they can bring to bear to create bubbles of athletes to really help control their behavior outside, the amount of testing they're able to provide. They're finding, when I understand at the collegiate level, they're questioning whether they could accomplish that at the collegiate level, which is why the Pac-12 and the Big Ten have canceled the seasons for the year. So whether other, the top five, the Big Five also do the same, it remains to be seen. But we've seen really in professional baseball, Major League Baseball, how hard it is to even maintain those bubbles. So the amount of resources it takes to prevent the spread through contact sport is just tremendous. And schools simply don't have those resources. I will say that I've received calls, concerns from teachers just in general about returning to classrooms because they're not always confident that it's going to be able to prevent the spread in the classrooms, even with all the measures. And there's always some calculated risk here. I just cannot emphasize enough, the more and more research is showing that children can be infected. They can be very, they can transmit the disease at a very high level. And that's evidence is just starting to show up more and more. And so again, I think what Dr. Greiner and Dr. Corvo and Julianne have done is tried to get out in front of this. We only ever have 1 to 2 weeks look at this virus to see what it's going to do. And you have to anticipate that. And again, having worked in high schools for 31 years out of my professional life as an administrator and short time as a coach, I understand, I appreciate deeply how important sports are to the educational experience of a student what it means to their families, to their friends, to a community. It's just so difficult. We just have to keep our focus on the virus. The sooner we stomp this thing down, the better we're all going to be. And I'm going to say again, I haven't been able to see my mother in person except through a window for the past 6 months and 5 months. And that is extremely painful for her, for all of us. And this is what we're living through. Commissioner McKiernan?
Thank you, Mayor. Commissioner Kane actually asked the question that was on my mind. I'll just follow up just a little bit with that. The last bullet point on page 2 of the health order says, this order remains in effect until conditions in Wyandotte County are such to warrant a change or modification. Now that, do I read that effectively leaves the door open, as Commissioner Kane wondered, that there could be a resumption of these activities in the fall?
Commissioner, yes, I believe that that's the case. And again, this is a moving situation and target, and every week seems to be, very different. And so I think that that's absolutely the case.
Okay, then this will go back to what Commissioner Bynum asked. Then my ask of you would be, stay in touch with the administrators of all the local high schools and all of the local people that are affected by this. And if there is the possibility, remote as it may be, that they could resume at some point, I think we need to constantly be talking to them, giving them status updates, because there's a lot of logistical details that go into the staging of events. And anyway, I would just ask that we stay in touch with them, keep them up to date on where we are, what the current data is, what our current thought is, what we're planning in the short term and in the long term. And if we can do that, then I think we'll be okay.
Yeah, Commissioner McKiernan, I think that's a great suggestion, and we'll take that to heart and to action. We've had a really good and strong relationship, I think, with our educators in Wyandotte County, and we'll continue that relationship. We've also set up a really kind of like a hotline for the schools, and so they can call our chief epidemiologist at any time. I've made myself as available to them as I can, and so we'll continue in that way.
Perfect. Thank you so much.
Commissioner Ramirez?
Thank you, Mr. Mayor. For continuing on the conversation of being maybe in the future, so that it's out there for the people who are listening and watching, Dr. Corvo and Dr. Greiner, what would be the statistics of the cases and everything going on? What would be the numbers you'd want to see to start maybe the possibility of resuming these sports?
Yeah, I think as most of you are aware, we have tried to some extent through this pandemic to not pin ourselves down with specific numbers, and I'll get into some here in a minute. But the reason for that is because we're really looking at a constellation of variables that you can really only understand those with what's called a multivariable, analysis equation, where you're taking new cases on a 7-day rolling average, you're taking hospitalization numbers, you're taking ICU beds used and ventilators in use, you're taking the death rate into account. And you're looking at clusters and how many clusters there are and how big those clusters are. And all those things go into this equation, right, that comes out on the other side as a thumbs up or a thumbs down, regarding some ordinance. It's tough for us to prioritize, honestly, any one of those things at any one time. But I think one of the big things we are going to be looking at, and this is something we will be talking to the superintendents and the other leaders of institutions and sports entities in the county, is clusters. If we're seeing outbreaks of cases in schools, or we're seeing them, we're continuing to see them relate to sports, even in other counties, that's a problem sort of sign. You know, if we're seeing outbreaks in clusters and case transmission from, you know, from youth and teens to parents or grandparents that lead to hospitalizations, that's a really bad sign. If we see none of those things, that's a really good sign. I think if we continue to see the case numbers get very, very low, which could happen, it'd be great. But I think the clusters will be the big thing. We'll be monitoring extremely closely, and we want to work with the schools closely on that anyway. And then the other thing I think we want to do as we talk about these numbers, Commissioner Ramirez, we want to communicate with all these entities out there. You know, help us drive more people to testing sites. Help us enforce the mask order and adherence and compliance with the mask order. Help us convince people to stay home when they're sick or symptomatic. Help us convince people to stay home for 14 days when they've had a close contact and should quarantine. I think invoking cooperation now, as people think about this, it might make a real big difference in the next few weeks and months, and then those data I think are going to look better. So that's a really roundabout answer to your question, but hopefully that's helpful.
It is, and thank you. And I understand that it is very many factors go into all your decisions and all of your equation you were speaking to. But thank you for trying to explain, giving an answer as best as you can. Again, thank you for all that you guys do. It truly shows in our community, and it is amazing to see how many people are abiding by the mask order, and so I'm very happy to see that. Thank you.
Commissioner Burrows.
Thank you, Mayor. Dr. Greiner, I just want to say thank you to you and staff. I know the job that you have cannot be easy. The amount of information you must be working through, the emotional tug that you have, the pressure, the political pressure that you must be dealing with. I just want to say, on behalf of those in our community that value your input, and the hours and commitment of staff, thank you so very much for watching over us. We sincerely appreciate your work, your guidance, and your leadership.
Thank you, Commissioner. I think, you know, we are very blessed to have all of you, I think, and have the mayor as a true leader in this too. We're talking with our colleagues around the state all the time, and it's a tough world out there these days with balancing, you know, normal human society with this pandemic, and so we appreciate all of you as well. Thank you.
Commissioner McKiernan.
Thank you, Mayor. I just got actually a question that I didn't know how to answer. The question was, does this order prevent us from playing games outside of the county? And so I think they're looking for a little bit of, does this just apply to events that take place within Wyandotte County, or the teams from Wyandotte County will not participate regardless of the location of the event?
I guess it does not prevent games outside of the county. We can only issue orders that pertain to Wyandotte County, although we would wish and hope that people who do reside here would follow the orders and not go out and play elsewhere, although I'm not sure that that's realistic. That's what we would hope. Certainly for people who come into our county who want to play games or have competitions or whatnot, they would need to adhere to our local order, and it is the responsibility of the school you know, that is located within Wyandotte County to get that message out to the other opposing team who would be coming into Wyandotte.
Thank you.
Commissioner Philbrook.
Yes, just to piggyback on that comment is that, but the school district itself, District 500, has basically shut down those type of activities for their students. So anything teams, you're not going to be participating in Wyandotte in Wyandotte County or somewhere else. That's my understanding. But that's the school making those decisions and putting those guidelines on, not us.
Commissioner, I believe that is correct. Yes.
Okay, seeing no more hands, I want to thank you, Julianne, Dr. Greiner, Dr. Corvo. Thank you for your time. Thank you for bringing this information forward to us. Thank you to the commission for joining in and for all those who are watching. We are adjourned.